pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So this is day 2 without the cane,
All right.
and it sucks. But not as much as yesterday did. For those that don't know, I had a horrible case of herpes. Was in the hospital for 4 days, Seneca Hill for about 2.5 weeks. And now I go to OT, PT, and they got me doing things I didn't know a body could do.
Great to get old, isn't it?
So, young lady, you are here to let us praise and honor you for 30 years.
Oh my God, and I'm only 29.
Amazing
how that
Goodness, another
works.
diaper case.
In tomorrow's world, if somebody showed up carrying a kid, they'd probably count it. I don't know. That's good. That's amazing.
Congratulations.
Does everybody in the committee know Tammy?
No.
All right, why don't you introduce yourself and tell everybody what you've been doing for 30 years.
Okay, and I've actually been doing it for 32, but a county employee for 30. So
Okay.
my name is Tammy Thompson, and I'm the Director of Programs for Children with Special Needs here in the county. Back in '91, they hired me as a contract employee. I worked at ARC to develop the early intervention program as we know it now. They knew it back then it wasn't a mandated program, but in 1993 it became a state mandated program. So that's when they switched me over to county employment. So I have to say that the early intervention program is my baby, and hopefully leaving it in good hands when I look to perhaps retire next year. So I eventually worked my way up. I had a great boss in Betty DeSantis who taught me a whole lot about a whole lot of things, and then eventually became a director, I think, in 1999. So that's what I've been doing, the early intervention program, preschool special ed program, and children and youth with special health care needs.
Can I ask you a question?
Sure.
Since you do have a lot of time, and obviously, as a county, we're having difficulty getting employees across the spectrum. What do you particularly, what brings you into this job every day?
The belief in my staff and the belief that the kids in this community need the help that they need early on, so that hopefully by the time they get to school, they're not going to need as much special ed. So hopefully making the world a little bit better place for kids and families.
So here's the big question. Want to do a picture today with all of our grunchies?
Sure.
Or would you rather do it during the legislative meeting when we're dressed up? What would your preference be for ever hanging it on your wall?
It's fine with me either way. Whatever easier for everybody else. I'm pretty easygoing.
I didn't want my good shirt to come in. Yesterday I had a sweatshirt on. I wore a good shirt because I knew there was going to be a picture today. I got long pants on. Some of us don't. Okay.
I don't have any long pants.
But I know you don't. No.
Yeah, I want to see that.
I
Raiders forever.
even combed my hair today.
Yeah, I see that, Frank. I'm really concerned about that. Raiders
It would require you to come back next Thursday and get
That's
that.
fine either way. Whatever you guys want.
If it works out for you, that'd be nice. Okay.
Yeah.
In the day-to-day fundamentals and efficiency of this county, we're trying to find a certificate.
Oh, I forgot.
Oh, you do?
You have a certificate.
I didn't know you were looking for it.
Didn't know it was missing.
So if you'd like to do the photo, we'll go to Chambers, do the photo. You can stand up and
That
say,
side over there, okay? I don't think anybody be mad at
Maybe
you.
we should-
I thought it was safe. You always wear shorts.
I know it.
maybe she can turn your.
There was no meeting last month, so it's the minutes from the previous month.
Should have been, yeah. Doesn't have it.
There's a correction on there
Oh, okay.
Is there? Okay.
that you weren't here, so I led with the pledge.
Okay.
You did a good job.
Okay, with that,
So
Are you looking at
Yes.
August?
Yes.
August meeting then?
Yeah, because September we didn't have.
But it's because it says September here.
Let's see, so-
So this has got to be corrected.
Yes.
So I gotta have the date.
And then if you go further down, and when there's approval of minutes, you're approving the August minutes in the September meeting that didn't take place, so.
Right.
Correct. You gotta correct that as well.
Thank you.
But I'll, as amended, make a motion to approve as amended.
Second. All in favor?
Aye.
Okay, you know how this works. You're up.
Okay. So, I hope I do this right. So HE1, resolution appointing a member to the Oswego County Board of Health. So we asked the committee to approve Dr. Ariane Hamlin-Smith, who was highly recommended by Dr. Watson upon his retirement from the board. Dr. Hamlin-Smith is a board-certified doctor of veterinary medicine, and she owns and operates Flat Creek Veterinary Clinic in Fulton.
I'll move to approve.
I'll second, motion for discussion.
This is good.
I do have a
That's
question.
all I can tell you.
Go ahead.
Is it normal to put a veterinarian on the Board of Health? I'm just curious as to.
Yeah, Dr. Watson was on there for years.
Okay.
Yeah.
So it's standard to have a veterinarian on the board, okay, that's all.
And if you look at her schooling.
Oh, yeah, well, sometimes
It's
veterinarians are better than
unbelievable.
doctors, because their patients can't talk.
I'll tell you right now, anybody who graduates from Cornell
Cornell.
carries a lot of weight in this
That's right.
state.
Yep.
A lot of weight.
Yeah, and there are often times when we're talking about the clinics and other things that are going on, Triple E, it's good to have a veterinarian on there. That's familiar with it. That's a good question. Any other comments? All in favor?
Aye.
Opposed? Motion carries.
HE2, resolution authorizing the health department fine schedule for environmental health services. So our fines have not been increased since 1995. So in order to keep pace with increased cost of doing business and in line with industry trends, we would like to increase our fine schedule. Most of them are about $25 increase. There are a few others that are a little bit more. And we also decided to add late fees. I think that was included, and I did bring a chart if anybody wants to outline more of the fines.
That would show on there about how often they're imposed.
Yeah, fines aren't as often as the fee schedule, but we do impose them once in a while.
I don't know how often they.
Not extremely often.
I would ask you a question, imminent public health hazard. What exactly is that we're only fining $50 and $100? If it's an imminent public health hazard. There's category one,
Category
category
one.
two. Category one seems like it's more severe. I'm just wondering what that might constitute.
I am actually not 100% sure. I would have to look into
That's
it.
fine. I have no problems with or issues with increasing fees.
Yeah, I have an answer for part of that.
Okay.
Part of that is if they're doing restaurant, food truck inspections and stuff like that, if they walk in and there's mold on the counter, the temperature is just way off on food and stuff like that, that's an eminent. They just shut it down and say, okay, you got to get this fixed up. The other would be maybe food in the cooler, that it's not been processed, but it's not the right temp. They voluntarily throw that away. That's not an eminent because it wasn't out being dealt with as part of being served to the public. Someday I'll have 30 years into. Go ahead.
Yeah, just want to comment to the committee, we haven't increased these fees in years, and that's, she came with us last time we had a meeting with increases in certain fines and like this, and again, these are 20 years old, some of these things. 2020, 22, somewhere in there, Phil. You might not even remember if it was so long ago. So it's time to catch up.
Did we have a motion?
No, not
I'll
yet.
make a motion.
Second.
Okay. Any other comments? Okay. Pretty good. I gotta get you in there sometime, Frank.
No, don't worry, it's coming.
All right. All in favor?
Aye.
Opposed? Motion carries. You're up again.
All right, HE3, resolution authorizing the increase of budget in the health department to purchase COVID vaccine. So we did expect that COVID vaccine would be commercialized. We budgeted extra funds for 2023, but we did not anticipate the significant cost of the vaccine. This is a mandated service, so we're requesting funding to purchase about 600 doses of vaccine, which we anticipate will be fully reimbursed by insurance.
When you say mandated service, you mean just that it's on hand?
Yes, that we have
Do
to
we have to provide?
offer it.
We have to provide that. I didn't just provide that.
Have a motion?
So moved.
Second.
Second.
Any other questions? Frank?
Will we be offering,
Yeah, so we were originally going to try to offer the flu and COVID at the same exact time, but we don't have the COVID vaccine yet, so we will be offering clinics. I'm not sure if it'll be at every county building like the flu, but we will offer it at the health department during our flu clinics on Monday and Fridays.
but you don't know exactly when or anything yet?
For the flu clinic?
No, not the flu clinic, because I don't do that.
As soon as the
COVID.
budget mod goes through, we can order it, and I know it's only probably a couple days after we order it, then we'll get it. It's rather quick.
Second comment that we knew sooner or later, giving it to us for nothing, it wasn't gonna last forever. So, it's typical. Sad, typical.
And it's very expensive.
Thank you, you guys do a great job, so.
How did they come up with that number?
Which number, the 600?
Yeah.
So we did, since we're offering it to county employees, we did surveys within our department. I know downtown did it and DSS. We asked everybody to survey their staff and see who would be interested in getting the vaccine. And then we just kind of added a few more, or some more, for the general public to come in. And we're shooting low,
Yeah, I was gonna
and
say,
then
it's
we can
really
always
best
order
guess.
more.
And we don't have to order it all up front, so it'll be ordered as needed. There's an order minimum of 100 doses, so we plan on ordering 100 doses at a time. So if it's not all needed, it won't be used.
Is there a time frame on when they have to use by?
Yes, it depends on the vaccine. Normally with the Pfizer, I believe it's about 3 months after you put it in the refrigerator. So
What if it's Moderna?
Moderna is good for a little bit longer. I'm not exactly sure the rate or the time frame, but normally we order Pfizer. I've been ordering lately.
Now, when you give the shots in here, because I've seen it over the years, when we gave different shots, right in the next cubicle
Yep.
over. You take the insurance cards on those, right? For
Yes.
Medicare and, well, us old timers like Frank, Medicare and
Yep.
your supplement.
Yep, there's a few that we don't, but we accept the UMR through the county, and then we accept Medicare. So any insurance that we will bill, we'll bill for it. If we don't take your insurance, then you would have to pay up front and submit it for reimbursement.
So, are you gentlemen all aware of the UMR?
That's our card.
That's the money that we get as legislators. I think it's $1,000 a year, and it is applicable to this. So if you don't have anything else set up, because they're not going to take your Blue Cross Blue Shield in that room, but they can take the UMR.
But I thought the UMR
Yeah.
card was only for dental and
No, I changed it.
eyeglasses. When did they change that?
That was, legislature change, had resolutions go through earlier this year.
Yeah.
Yeah,
I
you
thought
can
it
use
was
it
just
for dental
used-
for anything.
Yeah,
Oh,
and
really?
we will take any.
Should have gotten an email on that within the last.
Yeah, there was information out there.
Do you have a comment?
Yeah, we
Let's
take
not-
any
let's not be
insurance that we
absent like that.
participate with. So we would take a Blue Cross card because we participate with Blue Cross.
Yeah, I know you take it over there, but I know one time when I come to get a flu shot, they said, no, we do not take that here. If you're going to go over to the clinic, they'll take it there.
Interesting, that should not happen.
But as an
I will,
they said, as an employee base, we don't take that.
they should be, so I will have a conversation before they do clinics this year.
Okay.
They should accept
That's
anything
even
that
better.
they take at a regular clinic.
Good.
Location should not matter, so thank you.
Some of us old folks don't fit the mold and don't have Medicaid and Medicare.
Right.
Why do you keep saying some of us?
Because
You
he
keep
said,
saying old folks.
he did it.
Klein started it.
Yeah, I just,
Say, but there's not many
Hey,
younger
listen.
people in here.
yeah, right. Greco, if they can.
We don't discriminate against old people in the county, just for the record.
I know
We're
that.
starting to outnumber.
I just, when I pay for private insurance, I want to use it.
Exactly.
Bill me
Absolutely,
twice.
everything you can.
Okay,
Thank you.
all in favor?
Aye.
Opposed?
Motion and all that other stuff.
Alright, HB4, resolution authorizing the creation of 2 positions in the health department, 1 speech language pathologist and 1 certified special education teacher. As you are aware, we have upwards of 175 children ages birth through 2 on a waiting list for services, which leaves us out of compliance with state and federal mandates. By adding these positions, we're hoping that it would bring down the wait list to more manageable numbers. This will increase expenses, but we also anticipate an increase in revenue.
I'll make that motion.
Good second. And I have a question.
I just have a question. With the difficulty in getting certified teachers, do we see any problem?
I know Tammy has been in contact with a different county, and this is how they manage their wait list, by hiring them directly with the county. Most of the providers in the county are either going to schools or out of state to do services. So the hope is that they would want a state retirement job and come here. They would be provided one of our county vehicles as well to make their visits.
Anything else? Go ahead.
Yeah, I just reading this, and maybe that's just I'm naive with the devil, but to me, the word capacity means numbers. Now, the county's losing population to beat the band. What are we just losing? People that are older and don't have kids? Or are they being displaced by people that are escaping Onondaga County to try to keep their kids alive instead of getting killed in gangs and all that? Or what?
I'm not sure why we're losing population.
I mean, it's not like our birth rate is taking off.
No. I don't know why people are leaving the county.
People die.
Pardon me?
People die.
Well, no, but I mean, we're losing people.
Yeah, we are.
You know, we're talking about housing crisis. For God's sakes, have a Bolton and all the towns and like this. And of course, the houses are all full of lead and asbestos. But I mean, there's tons of empty houses because people aren't moving. In my district, I lost 300 and some voters whenever they do the count there in 2020.
Did they move away or just quit voting?
Well, no. What happened, Jim, is that I know a lot of them. You know, because my district has some poverty, and also have a lot of people with money. People with money got the hell out of the state.
So the only comment I'll make on this
People
is,
in poverty coming in.
That's
what
I'm trying to find out. Because, you know, our population's not taking off.
it's interesting to see this resolution because they sit on the NISAC Children with Special Needs. This is a conversation that more and more counties are going this way now to try to get their numbers. The state is just not helping at all. They're not funding anything. They're like, it is what it is. So if this takes care of that need, and again, it is reimbursable. It's a program that you put in. You may have to wait a while to get your money back, but you do get revenue back from it.
And I understand it, Jim, and I'm not trying to be a pain in the neck or anything, but remember one thing about reimbursement. That's my money still that went out there. I don't care where it comes from. We're still paying it.
I understand that, but by law, we have to serve these kids.
You know,
It's not a choice. It's not a choice.
I get it.
We're in trouble because we can't. We just can't get kids run through the system. So the state is coming down and saying, you gotta fix this. Well, you gotta fix this to get this revenue. they don't do it. And I'm just letting you know that in the last meeting, I heard several comments from a couple of counties, and 3 of them were upstate that have done this. They said, well, we're just doing this on our own, we're setting this up, we're not trying to master the program, we just want to create some relief, and it does create revenue coming back in. So,
It says in here upwards of 175 out of compliance with state and federal mandates. What are the state and federal mandates? What are their numbers? What are they looking for?
That's why I brought Tina.
So-
Well,
There you go.
she's doing 30 years.
So the federal Office of Special Education is the one that oversees everything from early intervention and preschool. I know it's all across New York State, everybody's having capacity issues. And I know you hate to hang in on a pandemic, but the pandemic did not do us any favors. So we had to stop home visiting. And so we lost some of our people. And then people started doing teletherapy, which is much easier because now you don't have to drive out to Altmar and then to Williamstown, then to Redfield. But the other capacity issues that they're just not graduating speech language pathologists and special ed teachers at the same rates as they used to. So the whole country, just like everybody else, is struggling to hire people because we aren't graduating the numbers that we need. And we do have an aging population of therapists who are retiring. They've even talked about bringing some of those folks out of retirement to try to be creative about how we service kids. And I will say the Department of Health, Bureau of Early Intervention, is relooking at early intervention because, let's be honest, we're doing home visiting. It's not that safe anymore to go blindly into somebody's home, not knowing what situation you're going to walk into, whether it's in downtown Oswego or it's Redfield. So they need to do something different in servicing these kids, and something that's more manageable and something that's safe for all involved.
So what's the threshold number that the state or federal is looking for?
Oh, they want 100% of kids serviced. We
We
have
don't really have a number.
no, it should be every child who comes referred to the program should be evaluated and a plan in place within 45 days, and then services from 30 days from that 45-day mark. All services should be started. So we get graded on that every year, and we used to do really well. I can tell you right now, a majority of our kids are not starting services in 30 days. We have some kids who've gone their whole time in their intervention without a certain
Yeah,
service.
because it's only 0 to 2 years old.
Yeah, it's not like,
And then they go on
They
to
can time out on that, on this program.
Yep, and then you go to 3 to 5, and we have the same issues in 3 to 5. So then they get to school, and school age, now the special ed needs are a lot higher because we have not been able to provide the services that they needed to help remediate.
I'm naive as hell on this, I don't understand. Did the state, because again, we're losing population, and people, young ladies like yourself aren't having kids. You know, they're having 1 or 2 instead of growing up with a ton of them in the house. And I keep them to be paying. But the thing is this, did the state change the criteria of who fits in this, or?
No, it's a
Well,
it's a
there's got to be a different health problem that's causing these kids to have so many of them declared.
I wouldn't
be in
say
this program.
I wouldn't say our population of kids has increased that much.
No, it hasn't, because the schools are sitting half empty, a lot of them.
But
At least my 2 are.
that doesn't mean that they still don't meet the criteria of developmental delay. So the state sets the criteria of who qualifies for the early intervention program. They're also looking at that. I mean, they may change the criteria and make it a little bit harder. Some states you have to have a 50% delay in order to get services. Not sure if that's really the answer, because the whole idea that earlier the better. And some of our kids after a year of early intervention may not even need our services anymore. And we'd rather give it to them early because, as we know, early intervention prevents all the money we're going to spend.
At the end.
Yep.
I'm encouraged to hear that we're soliciting retired people to come back out. And I wish there was a way, and hopefully there is, in all aspects of our government to bring retired people back to work. Not full-time, because who wants to come back once you retire full-time? But if we could split the week, you know, maybe you come back retired, work 2 days one week, 3 days the next week, and we get somebody to fill in the other half or such. There is nobody to fill these spots. You're right. We're not graduating enough people. There's nobody to take any of these positions in any facet of our government. Population is such that it's not there.
And
Not there.
even if you do have ones going to come back full-time, the state blocks that because then you're required to have a waiver and you gotta prove that they're the only person in the world who can do that.
That's
job.
correct. Yeah. So if we do part-time, perhaps we could keep it under the waiver capabilities of thresholds.
And the other thing is, when you have a 30-year employee like yourself, they take all that experience out the door.
I'm still a phone call away. I'm
There
a
you go.
sucker.
Yeah.
I've already told people I will, there are 2 people I'll take phone calls. Well, Vera, Jen and whoever will take my position, we will utilize that.
You shouldn't have told them you're working one more year, because they're gonna bring this up every month.
Oh,
now.
I'm not working 1 more year, Jim. I'm
Oh.
talking 5 months.
5 months? Well, that's still 5 meetings, you gotta convince her to come back.
Sure, that's right.
Okay. Good. All right, all in favor?
Aye.
Opposed?
Right, and the last, 825, resolution authorizing the health department vehicle leases for vehicles. So we are requesting approval to trade in 4 county-owned vehicles. Prior to COVID, we were planning to change out vehicles every 5 years, and that didn't happen. We did discuss with Enterprise, and because of the used car market right now and the availability to have the vehicle by 2024, they said we should start the process now. We will not be changing the overall number of vehicles in the fleet, we're just trading in the ones that we have. Well, the 5 that we have. 4 that we have.
And even as expensive as leases are now, they're still cheaper to do it this way than buying new. Because that's going up, and with the strike, it could be even worse.
Is that a motion?
So made.
Second.
Second. Any discussion? Go ahead, Frank.
Just recently, we were purchasing vehicles for some department. Can't remember which one. But at that time, I said, I thought we were leasing all our vehicles. And I believe the statement was, well, because the leases are so high, it's better for us to buy now. So that's why I'm just wondering, I'm not, I'm not against this, but I just wonder, is this the avenue that we're gonna take? Because there are other, ones that we bought. Because we just purchased some vehicles. I think it was DSS, I'm not too sure.
I think that was the case when those vehicles were available on the lot. And we hadn't really looked, and that's what spurred us to take a look at whether leases or purchases whether the lease program was still good. I don't know, I can't remember if that was DSS or probation or highway. But,
It was DSS. I think it was DSS.
Yeah, it was
DSS. Yes.
Yeah, and it was, I think there was an availability question too. Plus, of course, DSS gets hefty
They
reimbursement.
get a lot of money.
Yeah, and,
Reimbursement's still my money.
yeah, I know.
It's just spread out over a lot of different people, but I understand.
Yeah.
I just wondered, well, why are we leasing again when we thought we were gonna buy?
Well, in my enterprise program, when they sell a lease, we get some of that back. So when they sell it for us, it's part of the program, so that's a benefit of that.
Okay.
Maybe state money, but I'd rather get it in Westchester County. All in favor?
Aye.
Opposed? You got one more.
There's the only one.
You don't have one more?
I do, I don't know the person, but I printed it off.
Try it.
So HE6, resolution appointing members to the Oswego County Traffic Safety Board. We would like to nominate Sergeant Garrett Marino from the City of Fulton Police Department to be appointed to the Oswego County Traffic Safety Board.
A second.
Second. Any discussion? There's a short write-up on the back of your, if you get a chance to read it.
I
Good.
don't know the gentleman.
All in favor?
Aye.
Opposed? Motion carries. Before we do updates, just be a second. I've invited Eric Brzee from Farnham to come next month. They were going to try to come this month. They're building a huge new facility behind the Price Chopper store on George Street, which will expand mental health capacity, abuse capacity, all the services that they do. They'll be able to move over there, and they would like to come and just show everybody this is what it is. They're not trying to sell anything. They're not asking for anything. They just want to make sure that the county's aware. Once that building starts to go up, it's going to be very large, and that that's what it's there for. I thought that was a great idea, because with help, and of course, anybody you think that needs to be here for that, I'm going to put him on first to the agenda. And he can do about a 10 or 15 minutes when he's out of here. But it's just to bring everybody up to date. They've got their final plans done, they're ready to break ground. They'll go pretty quick after that. All right, department.
So for OD MAP, for overdose in August, there were 17 non-fatal overdoses, 1 fatal, 13 doses of Narcan administered. In September, there were 19 non-fatal overdoses, 0 fatal, and 14 doses of Narcan administered. So year to date for 2023, 126 non-fatal, 15 fatal, and 83 doses of Narcan administered. As far as environmental, Dirt Week is going on, so our staff's pretty busy with getting permits set up and just making sure everything is going as planned. We did have our first triple E reported on the 12th of September, so we sprayed Toad Harbor on the 18th of September. Our last rabies clinic is October 11th in Scriba, and that'll wrap up for the season. We did discharge our last bereavement case on September 22nd, and then we mailed in our operating certificate to the state, so hospice is officially closed. You will notice that we're going to keep it on our website, just so in case people are looking for it, it'll just direct them on the different agencies to call. As far as our preventive department, we're preparing for the upcoming respiratory season for flu, COVID, and RSV. Our flu clinics start for the county here next Thursday from 12 to 2:30 in the tobacco room up here. So if you want to get your flu vaccine, will be available. We are starting to schedule some adult homes throughout the county as well. And then, as I mentioned earlier, our walk-in flu will be Mondays and Fridays, 9 to 11, 9 to 3. We were very, very busy with back-to-school clinics. We were holding additional clinics 3 to 4 times a week, weekends and evenings, trying to reduce the number of children that were excluded from school due to vaccine status. We're on the tail end of that. Today we have some more appointments scheduled, but everybody hopefully will be caught up soon. Healthy Families has completely transitioned to the health department, and I'm happy to say that as of the 16th, we will be fully staffed, which is the first time we've been fully staffed, and I have no idea how long. Everything seems to be going well. August 2nd, we had a site visit, and our program capacity in 2022 was 33%. We're up to 65. We're higher than that right now, but as of August, we're at 65%. Performance indicators in 2022, we met 3 out of 15. In August, we were meeting 8 out of 12. And our performance targets in 2022, we met 3, and we currently are meeting 8. They were very impressed. We were on what they call a watch list prior to this, and we're been taken off the watch list. So this program is thriving. So I'm glad that we stuck it out and stuck with it. It's an excellent program for our company. And early intervention, Tammy's program for EI received 35 referrals in August. We already talked about the wait list. And then strategic planning and accreditation, we continue to meet weekly on our accreditation. We're making changes with our branding, so you'll see our letterhead changed. We're getting internal and external signage, redoing all of our policies, and gathering tons and tons of documentation that's required. That's it. Unless you have any questions.
Any questions? Go ahead.
Yeah, the overdose rate. You have last year's figures, Phil?
I don't, but
Or
I
are these
can,
inclusive? Like, in other words, this includes all the agencies in the county. Who's reporting this?
all of the agencies that report to ODMAP.
Who doesn't report? Is there any that don't?
Right at the moment, I don't think there's anybody not.
Yeah,
Okay.
I don't think
So, can you email me last
Yeah.
year's figures? I'd be curious to see that. It's more quicker.
Yeah, the health department kind of took the lead in that with the other agencies, and they're all pretty good about making sure the information gets.
We have one staff member that works strictly with ODMAP. She does the Narcan trainings. She's for the FAST team, so I can grab those figures for you and let you know.
Appreciate it.
Frank?
2 questions.
Yep.
What is the population number in order for special permits? The reason I'm asking is last weekend there was the outlaw track and what's that school? Well, it was called racetrack, but is there a number that I somebody gave it to me once before. I think Dr. Ching Chang gave it to me, but I can't remember what it is. But I mean, the parking lot is packed with campers, and I'm just wondering, is it healthy? Is it what is the criteria? Because they don't. The last time they didn't meet the special requirement, but it's growing so much that they got campers all over the place, and they're right on top of each other. So I'm just wondering if there needs to be, not that I want, but I just want to make sure people are safe. That's all.
Yeah, so the health department, the environmental will go down, and then there are capacity on the fee schedule where they do have to pay for, depending on how many campers that they have on the lot, they'll have to pay a certain amount of money. But then our environmental will go down and monitor.
There's no number that set number that just if there's going to be a gathering, because it's the whole weekend. It starts on I think it started on Thursday. I think I could hear them on Thursday.
If there's a attendance of 5,000 or more, they need a mass gathering permit.
But that it has to be 5,000.
Right.
So I guess that's out then.
And that's a good point, because
It's not 5,000, but it's a lot. It's in danger of problems. That's all.
it's not an every weekend situation.
No.
But prior to Dirt Week, those are the finals, and a lot of them racers move on based on how they place there. And Frank's correct, it gets a little crazy. In fact, I was going to mention, if any of you use City Line Road, you may want to avoid that this week. They changed the traffic pattern, and it is very interesting. And you may not want to sit behind 15 or 20 campers that are trying to get into one area, get registered, and move. So,
we drive out there every day, and it hasn't been bad.
and I think the new traffic patterns
Yeah,
will
it's
help a
been
great
fine.
deal.
And they closed East Albany, which is fine.
Right.
But
With that, they close every traffic pattern.
it hasn't been bad.
Yeah, it used to have campers coming both ways, trying to turn in, and they took the one away from them and said, you can't come in this way and can't. You've got to go around and come in one direction only. The interesting part of that is sometimes they're backed up on 104, because we can see them from our windows.
So now they have 5,000. Is that for the whole length of it, or is that just on any day they got 5,000 people?
Super Dirt Week?
Have you been out there?
Super.
Yeah, but I don't see where 5,000 people.
They have 5,000
Yeah.
employees.
I mean, you should drive out by just to check it out, because it's really pretty interesting. It's set up well.
Yeah.
They closed the Christian school for a week, and
Right. Well, I've been by it when we were delivering out to that place on Town Line Road there.
yeah, by 104.
Yeah. Okay, I have one other, just one other
But they
question.
do have a mass gathering permit, that's what.
Yeah, I know they do,
Yeah,
okay,
okay.
they do.
Before you go further on that though, Frank, I just want to point out, I'm not into harassing people because they're doing well and they're busy, but if it is a safety issue, a real sense of safety, there is drone capabilities that can count the population. So if
And
we
they are-
really needed to get a count, we can get a drone up and do an accurate assessment.
And they are doing that.
I'm not looking to harass people because they're doing well.
No, they're doing that this year.
Yeah.
Last year they played with it, I think, a little bit. This year they've got 2 different groups there'll be drones in the sky all the time. So, that's a good point. I'm sorry.
Second question. The food inspections, okay, for the bars. Have you heard any complaints other than one complaint
No.
that you know of? You know, Mr. Soloway and I have got the same issue.
We'll be checking into that.
I know that I've been, gotten information that there is more than there will be look at it, because I can't see a bar getting charged that does not have a menu, does not serve food, but the rate went up for that inspection fee because they have ice. I know ice can be, contaminant, but let's give these people a break that, they're not serving food. But their rate went up the same as a person that's got a full menu. Whereas all they've got is people there that are drinking and having some potato chips maybe that you have the box. I said that I would bring it up, and I'm sure Mr. Soloway.
And I'll be in touch with you.
I was gonna say, I can look into it and give you
Yeah,
more
and it's,
information after.
but the thing is, the state says no matter what, that's what it is. But I think we should be more lenient on, we know there has to be a fee, we know there has to be an inspection, but I think we have to be a little bit more cognizant of what are they doing there, okay? And if it's just ice, I have a hard time raising a fee.
Well, you don't drink a mixed drink then.
No, I don't.
Ice is pretty.
I would think, I drink soda, soda's got ice in it, but, I can't remember the last beer I had. So, but thank you very much, let me know, appreciate it.
I have 2 items of personal involvement. The first one is the mosquitoes. On August 17th, I went with Chris Williams out to the mosquito trap in West Monroe. Out there, and that was extremely interesting. I'm glad I did that. I saw how to identify them, how they do that, put in all the little vials and send them in and everything. On the way back, Chris said to me, he says, I'm going to go back to the office and submit this report now. He says, it'll probably sit on the state's desk for 2 to 4 weeks. That's exactly what happened. Because ironically, the same day we sprayed, on September 18th, there was on TV, there was an interview with the Onondaga County Board of Health, and they just ended their spraying. So it just seems once again that we're behind again. Is there anything we can do to expedite that?
No, that's on the state, so as soon as we get the mosquitoes, we will, you're talking about from the time we get the mosquitoes
Yeah.
until we get the positive
Yeah.
report. I think it depends on a bunch, so we'll send those off, and usually our mosquito kits, I know that's not the correct word, our summer interns with mosquitoes
Yeah.
will drive them out there, but it depends on their lab capacity, how fast they can get it to the lab.
The other issue, in comparing us to Onondaga, Onondaga just sprays every year, no matter what.
They just
They don't wait for there to be a positive confirmation of triple E. Our county has always waited for that to see if it's necessary first. They spray, so they kill it. So, that would be why they'd be in the spray program. But we're just starting because they spray regardless of whether it is clear.
And then we usually get the imminent threat to public health prior to, which takes a few days as well.
The other thing I have is we unfortunately have a personal involvement with my mother-in-law with bone cancer. We're taking care of her, and we just involved hospice last week, and it was hospice in Central New York. I just wanted to say that they've done a wonderful job. They've been very accommodating. They've come right in. They've been so compassionate, and they're there all the time. You call them and they answer immediately. They'll send a nurse out. They're doing a wonderful job.
That's good to hear.
Yeah.
It was sad when our hospice
Yes.
closed. It was very sad. Nobody wanted to see it happen, but it's good that there's other services. And I know Essentia is currently, they're not up and running, but they're getting ready to
That's
start.
what I asked the lady who came, the nurse that came out about that. She says they're not ready yet.
Not yet.
Essentially.
Our hospice supervisor actually switched and is employed there as well. So hopefully she takes her knowledge and helps them along with the process.
Mhm.
Do you have something?
I was just gonna say, if we're having this problem year in and year out, which it seems to be, at some point, why are we doing the testing, waiting for an extra 4 weeks for it to spread before we spray? We should probably, at some point, pick up what on in August and just go ahead and start spraying. If it's gonna happen every year, we don't, I mean, it's like the ticks, right? They all have Lyme disease now, so there's no point in sending them in. I know they encourage you to send them in, but I went to my doctor and said they all have them. You get the shot, you get the pills. So, I mean, at what point do we decide that, this happened every year since I've been here, we've been spraying, right, Jim? I mean, it's not.
We haven't had to spray every single year. Yeah, but that's a discussion. That's a policy that the county has followed for years. There are reasons behind it, or the financial. We're getting a problem where there's longer and longer delays, then it's worth revisiting. But generally, when we have had a positive EEE, and our public health director requests a declaration of imminent public health threat. It's only been the last year or two that's taken more than a day or so to get that. It's come in pretty quickly after that.
So you don't think it's an issue that we should kind of get out of?
No, we should take a look at it if there's questions. It's always good to revisit policy because it changes.
Well, it seems to be only unvaccinated animals are getting this, right? I mean, the horses that don't get the vaccine.
Our last positive case was over 5 years ago. I think it was there was one in Palermo and then Elmar, or Albion.
Because they do have vaccines.
Go ahead.
Spokesman for mosquitoes. I think we should just not randomly eliminate some innocent mosquitoes.
Frank, you take a ride where I took in that pickup going out to that mosquito
take a
trap.
ride.
I tell you, you drive down there,
Bad.
that truck was covered with mosquitoes and bugs and ticks were over
Were they
there.
all bad? Were the mosquitoes all bad mosquitoes? You don't know that.
They had a dirty look on their face. When I examined
Yeah,
the mosquitoes,
they probably came down here from out of town. They came down this way. They got scared.
It's been a while. It's been a while since.
I have a question for you
Okay.
Just a quick note, you mentioned hospice, and I mentioned this in Human Services yesterday. Our Friends of Hospice program did not disband. It's a very important program in this county. They provide like all the little things that a hospice organization cannot do. So if somebody's having a birthday, they can provide a birthday cake, gift card, get one for the person. If there's a need for a different type of blanket, a special pillow, things like that, that it's not being covered. Friends of Hospice is still alive in this county and very much doing that. They do little bags of stuff that people may need, very involved with anybody that's in the hospice. Their Hotcakes for Hospice is Sunday. And the Laker boys,
Where is that?
it's at the Elks. They show up, and it really is a good time because these kids that play hockey are all of a sudden waiters. And it's great to just kind of rub them, give them a yeah, thank you guys for coming and doing this type thing. It does serve a purpose. But I've heard several people say, well, we're not doing hospice anymore, that stuff has all gone away. No, we're not providing the service, but our organization is still alive and well, and working with the other hospice programs. And if they're working with somebody that has a need, this group still does it. So,
And they're still doing Camp Rainbow.
And they're still doing Camp Rainbow.
Camp Alice.
yeah, I missed my this year, that was not gonna happen, but we made up for it. We had to go to Minetto Elementary the other night, and she got mobbed. 300 kids. Okay. May I have an appropriate motion?
Motion adjourned.
Second, anybody? All in favor?
Aye.
Thank you, gentlemen, very much.